So cognitive analytic therapy was started in the 1980s from Guy's Hospital in London by a man called Anthony Ryle. And basically, the term is based on cognitive for thinking, analytical because it has some components of psychoanalytic theory and practice in it. And then the T is therapy, so CAT. And basically, it uses attachment theory and elements of CBT. And it's a very much a sort of equal therapy in the sense that you don't feel as a doctor with hypotheses up their sleeves, analysing and then feeding back in a way that's a teaching way to the client. It's very much an exploration, a relationship between the therapist and the client. Well, I think it can be useful for anybody who's suffering any type of distress. Basically, it's looking at patterns we develop in childhood that we use very sensibly to cope and to attach to others. But sometimes these patterns might not be useful in adulthood. So we might please people, we might repress our needs, we might strive to achieve things and so on. But these are not adaptive necessarily in later life, in relationships, at work, in a number of areas of our lives with friends and so on. So what we're trying to do is look at the roles we learned in childhood. So perhaps we might have a very critical role. It's not a parent blaming exercise, but it's looking at how we get information about the world and about ourselves. So if we're in an environment which is very critical or has high expectations, we might find ourselves in a striving position or a feeling of not good enough. And then we will do things thinking, feelings and actions will emanate from that position. And these are very effective in our childhood, but in later life, they can be troublesome. So it can apply to lots of conditions, if you like, or lots of feelings of being stressed, depressed, anxious, many areas. Well, again, I think it's, there's no ideal candidate as such. There's somebody who I see a lot of people who are perhaps feeling low, their mood is low, or they're stressed at work, or they're having relationship problems, or they're feeling lonely, they may be anxious, they may have panic attacks. A number of categories or diagnoses can be used in terms of a presenting problem for cognitive analytic therapy. It could be eating disorders, bullying at work. So there's no ideal candidate as such. Typically, the sessions were used, well, it started, as I say, it emanated from Guy's Hospital. So it was used in the NHS. So originally it was time limited, and that's its basis. So for people who couldn't afford to spend money on long-term therapy, perhaps, well, importantly, that is so when it started. So it would be time limited. So it was normally 16 to 24 sessions, but they can be extended. But the aim really is not to keep the person in therapy for year after year and to look at unconscious drives and so on. It's to look at practical help, but also look at these underlying beliefs that one may have gathered about oneself and what one does in relationships in the world and in relationship to oneself. So, for example, if you've had an upbringing which is quite critical, you might become quite critical to others. You might feel not good enough, but you also might criticize yourself a lot. So we're looking at interpersonal relationships and intrapersonal or internalized relationships. I wouldn't say there are side effects. No, in terms of if you're using a medical basis, if you take this tablet, it may make you feel drowsy or it may make you feel more anxious. For example, with an antidepressant you might take, there would be side effects and you can look those up. The only thing I'd say is that we have a book written by Elizabeth McCormick-Wilde, which is called Change for the Better. And I think if you want to call it a side effect, if we are with people who are used to us behaving in a certain way and our identity is such to those people and to ourselves that change can be difficult, not only for ourselves, but for other people. So if you want to call it a side effect, you might find that presenting yourself in a certain way, or perhaps speaking up for yourself, or being listened to, or asking to be listened to, for example, might cause a few ruffled feathers. You might need to go through some rocky ground before you come out the other side, if you like. So I don't think there's any change that can take place without some sort of adjustment on other people's behalf and for oneself.